Hi everyone, welcome back to one of our 12 Days of Wellness segments here at Ogden Clinic. Today I am joined by Dr. Nathan Brown at our Canyon View location. Can you tell us a little bit more about what you do here?
I'm a family medicine provider here at Canyon View in Ogden. Seeing just, I guess anybody from birth to Medicare age, just taking care of whoever we can.
So our segment for today is all about how we beat the winter blues and how we can feel better during the winter. So to start off, how does the winter affect both our physical and mental health?
Yeah, so it is interesting that the different seasons can affect us physically as well as mentally and emotionally. I think everybody's felt that emotional change, with the different seasons coming and going. Some of the physical changes that I think a lot of people are at least semi-aware of. There's different hormones and stuff that are released with different amounts of time exposed to the sunshine, as well as I think as some people know that vitamin D is created in our skin when exposed to different wavelengths of light, specifically UV B rays. That's one of those physical things that can happen as we don't get as much sunlight as we did previously in the summer and in the spring and also in the fall. As we don't create as much vitamin D, it can affect our body in different ways. One of which is the absorption of calcium. When we don't get enough sunlight, we don't make enough vitamin D, and if our vitamin D is low, we can actually absorb less calcium, which can affect our bones and some other aspects of our health. Now, it's especially for those postmenopausal women that already have potential issues with osteoporosis or osteopenia. That can be a little bit more significant. And that low calcium can affect your parathyroid hormone and your kidneys and things like that as well. It's not usually very severe, but those people that are already sensitive to those types of problems, you can exacerbate things a little bit.
That's really helpful to know, and I think, like you said, a lot of people know the common things that happen in the winter, like getting a cold or things that you would think that are common every year. One topic that's really popular and really prevalent amongst kind of the area and the community here in Utah. Obviously, we don't see a lot of sunlight. It's been snowing for like 5 days straight, so that can affect people. And one of those things is seasonal affective disorder. So that's really what our segment is going to highlight today, talking about that. So can you tell us what seasonal affective disorder is?
Yeah. So it's more than just feeling a little bit off. I mean, it can the sunshine can affect our mood, and I think everybody's affected by that one way or another. But seasonal affective disorder is actually depression that's induced by the winter. It's not its own diagnosis. It's actually a subcategory of major depressive disorder. And I think it's important for people to understand that it's not just, hey, well gosh, I'll just walk outside for a few minutes and I'm going to be a lot better. It takes. Now, if somebody truly has seasonal affective disorder, it takes some actual intent and some actual work to kind of help solve that problem. It's not as simple as just trying to put a smile on your face.
Yeah, that's interesting. You mentioned it was like a subcategory, goes often undiagnosed. What are some symptoms that people should kind of look out for to know if they need to seek help or talk to their provider about it?
Yeah, so some of the symptoms that people might notice are the same ones that are involved with depression. Things like that depressed mood, guilt, decreased energy, oversleeping, things like that. But there are some, other things that questions you can kind of ask yourself. Do I feel better when I'm in the sunshine? If it is a sunny day in the winter and you get outside and do something, how much better do I feel? And these are people that actually have, maybe are diagnosed with depression, and they're like, is mine just a seasonal depression, or is it a true depression, and or just a full depression? And you can ask yourself some of those questions about other than the main depression questions, and things like do you oversleep in the winter more often? Do you have those issues with energy and sunlight? Do you want to spend more time with people? Are you more social? When there's more light outside and things like that.
So for someone that, might have seasonal affective disorder that maybe doesn't have, that full depression scope like you mentioned, what are some things that they could maybe do at home, some recommendations or some tips of things they could use? Tell us a little bit more about that.
Moving into those months, since a lot of people do have some of those symptoms, I think it's definitely worthwhile for people to try to make some improvements on their own. some of the things we definitely look at is with light. They have some great options for light therapy, and I think a lot of people have seen the happy lights around places. I've seen them at other workplaces or in stores. So getting some wavelengths of light during certain times of the day can make a big difference. Studies have shown that getting it in the morning is better than getting it in the evening. So the only time you have to use some light is in the evening. You're not getting as much improvement as you could. So if you've got a happy light or something and you can use it at work in the morning, or when you first wake up and you're trying to brush your teeth and get ready for work, that's a good time to do it. Using it for, I think the studies showed between like 6 and 8 in the morning, so a good 2 hours of light made some statistical difference versus not having any light. And even then, like we mentioned, having light in the morning makes a statistical difference. It's better than doing it in the evening. In addition, they do have those dawn simulator lights, which some people might have heard of, that try to be the rooster in your room. As it kind of helps wake you up in the morning, and simulating sunlight that we normally get maybe in the spring or summer months. And those can also be very beneficial and be helpful in the morning, just to kind of help wake you up if you don't have the 2 hours between 6 and 8 to enjoy some light. So those are some of the light options. As with any other type of depression or mood disorder, getting exercise actually makes a big difference, and it's actually a term called behavioral activation, and finding a way to activate yourself can make a difference. Some new studies have just come out showing that frequent walking helps push back dementia 25%. So there are a lot of great health benefits from walking, not just from a mental health aspect. Again, though, if you're trying to do things on your own and you're just having some insufficient improvement, and you're still having symptoms that are truly affecting your life, how happy you are, how well you interact with others, then it might be that clinical diagnosis of seasonal affective disorder instead of just some simple winter blues. In that case, it really could be very important and beneficial to speak with your doctor. Some people will have great improvement on medications, and sometimes people are a little bit shy to start them, but after they have some good improvement and it can make their winter months better, it can be a quality of life change for them. On top of that, if people are taking medications and they're doing light therapy and they're walking, doing everything they possibly can, they can still get some benefit from kind of like psychotherapy, counseling, and those types of things. It's nice for a lot of people because a lot of people come in and they are asking if they can find a counselor somewhere, and you're like, oh, actually we have one that comes in our clinic. I think it's a lot easier for people to feel more comfortable coming and seeing a counselor
Absolutely.
in the medical clinic that they've been to. In addition, they usually will take the same insurance that you have here with Ogden Clinic. So I think that's reassuring for people too, instead of having to call their insurance and be like, hey, who do you cover? Oh, all right, where are they? And then call them. We can schedule that in the clinic with them. So.
Yeah, that's awesome. And that's a great new resource that we integrated actually this past year. So like Dr. Brown said, it's something you can find across 11 of our locations, which is really awesome because like he said, you don't have to go anywhere else and stay here. So for someone that's like watching this segment and is maybe thinking, maybe I do want to seek help, or I want to talk to my provider about, potentially getting a diagnosis for, either depression or seasonal affective disorder. How would someone prepare, to kind of ask those questions? Because some people don't know, how to kind of approach it. From a provider perspective, what are some questions that you would recommend people ask when they do come to their appointment?
That's a good question. And I think some of it just starts with people kind of asking themselves the important real questions. Depression there are like 8 or 9 different potential diagnostic criteria for depression, which, of course, for a true seasonal affective disorder needs to be present. But the one that's necessary for any diagnosis is depressed mood. So you have to kind of ask yourself, like, do I feel like I have a depressed mood? Do I really feel down? Is it just in my head? Can I just, push my way through it? Or do I have a depressed mood? And not only that, but is it affecting my life? Does it affect my quality of life? Is my family being affected by this? Am I less happy than I could be? Are there things that I would otherwise do but I don't do because of how I'm feeling? And I think those, knowing that there's a quality of life change that is happening to you that you could hopefully reverse, and have an improved quality of life? I think those are the important questions that people really should be asking. And if that's the case, then I mean, we're definitely happy to help, make you happier, make you, help you feel a little bit better. And while it's not necessarily that, medication makes you happy, but sometimes the medication can help pull away some of those things that are making you sad. And, if it's something as simple as a hormonal change that just needs to be addressed, it's something that is kind of reversible in some ways. And I think it's definitely worthwhile looking into. But so the questions, number one are just those depression questions. Depressed mood, is it affecting my life? And number two, does it happen every year at this time? You always hear people saying like, oh, every year this time I get a sinus infection. Every year at this time I get bronchitis. Every year at this time, ... Do you say every year at this time I get depressed? Is it after Christmas? Does it happen? Does it start in October? Is it also present in January? And if those things are going on and the season could be brighter, talk to your doctor.
Well, that was really great information, and like he said, seeking help sometimes really helps a lot, and it can be a little scary for some people, but just acknowledging that there is people out there to help you. Even with Ogden Clinic, we have awesome providers, and we also have counseling on site as well. So is there anything else that you want to add in terms of seasonal affective disorder or any other recommendations?
No. Other than look for it in yourself and look for it in your friends and family. Sometimes you have to ask yourself the hard questions, and sometimes you have to ask them to the people you love as well. So just be on the lookout and see if you can make things better for somebody else as well. And
then I do have one last question for you, because this is a Christmas segment. Mm-hmm. What is your favorite holiday tradition that you have with your family or that you did growing up?
I think we might have just started one yesterday. It snowed, and we had actually a party with some friends, and we got out cups, and we got snow, and we made snow cones.
Oh, awesome!
Yeah.
Did you put like syrups on them and everything?
We couldn't find any snow cone syrup because it was out of season, so we made our own out of like juice concentrates and things like that.
That sounds awesome. Yeah. Well, that's a great tradition. Hopefully it continues. Mm-hmm. But thank you so much for your time. I hope the people watching get a lot of good benefit out of this, and we wish all of you a very Merry Christmas. Thank you.